Virtually every major pharmaceutical company in this country has either been convicted of fraud, i.e. ripping off federal government, state government, or individuals, or else has reached a settlement. And we have got to get a handle on this crisis. Now, I want to read. I'm going to bore some people because it's a long list. Sadly, it is a long list. But it's a list that has to get out, and it is an issue that we have got to deal with. So here we go. Abbott Labs is one of the top 10 pharmaceutical companies in the world. It had $38.8 billion in revenues and $4.7 billion in profits in 2011. Just last month, Abbott reached an agreement with the U.S. Department of Justice to pay $1.6 billion for illegally marketing the anti-seizure drugs Depakote. Johnson & Johnson is the second largest pharmaceutical company in the world, which had $65 billion in revenues and almost $10 billion in profits in 2011. In 2012, this year, Johnson & Johnson illegally marketed Risperdal, an antipsychotic medication, to nursing home patients and paid over $2 billion in fines.
The manufacturer of OxyContin, let's talk about this for a second, Purdue, told our providers, nurses, docs, healthcare providers across America, we finally have a non-addictive painkiller. I mean, what a dream, right? Well, the folks started passing it out, and a lot of folks got on it and became addicted, and I think a lot of providers started going, wait a minute, this doesn't seem to be working out quite right. And they started looking at it, and I mean, this is a history we don't talk about much, but Purdue, the manufacturer, was taken to court. 3 of their executives were charged with lying to physicians that they had information that this was in fact addictive, but they told providers it wasn't. They paid a $70 million fine. Nobody went to jail. But in that same year, they sold $11 billion worth of painkillers. So, I mean, math is tough for some politicians, but last time I checked, there's 1,000 million in a billion, and so they paid a $70 million fine, 11 billion sold. My point is, we all talk about how we can spend more resources fixing the problem, and we aren't willing enough to look at the global challenge. The global challenge is this. In 2010, we prescribed enough OxyContin in America to keep every adult in America high for a month. That's just a fact. In 2012, we sold 250 million prescriptions of OxyContin. I mean, we know we only have 250 million people in America, right? That's a bottle for every living adult. The FDA just recently, and I say the FDA is part of our problem, they just approved Zohydro a couple of years ago, which is OxyContin on steroids, right? You can crush it, it's tamper resistant, you can shoot it, you can snort it. So we're right back there all over again. This year, they just approved, and on the Zohydro, it's important to note, their 13-member advisory panel, which is mostly docs, voted 11-3, do not approve Zohydro, because it'll be a bigger problem than OxyContin, but they did it anyway, right? Now this year, they approved OxyContin for kids. I mean, you can't make this stuff up.
Mr. President, in 2010, the pharmaceutical industry achieved a dubious distinction. It surpassed the notoriously corrupt defense contracting industry in defrauding the government. The pharmaceutical industry accounted for nearly half, $1.8 billion of a total of $4.1 billion of the penalties collected in 2011 by the Department of Justice, Health and Human Services Healthcare Fraud and Abuse Control Program. In 2012, and this is really quite amazing, the pharmaceutical industry is expected to pay out up to 4 times the amount of last year's penalty, between $8 to $9 billion. $8 to $9 billion in penalties due to pending fraud settlements with the Department of Justice. Virtually every major drug company has either been found guilty of or settled charges of significant fraud over the last 10 years. The question arises, and this really is an important question. Is fraud within the pharmaceutical industry the exception? Does it just happen here or there, or is it simply put their business model? Is fraud the business model of the pharmaceutical industry, who think that in most cases they can get away with the fraud, make huge profits, and in some cases when they get caught, they will in fact pay a penalty, but the penalty will in no way match the kinds of huge profits they're making from their fraudulent activity. It is clear that the punishments that we now have on the books have not done enough to address this problem, because apparently the drug companies are not too intimidated by the laws on the books. They think it makes business sense for them to continue going forward on their fraudulent activities. The amendment that I am offering would send a strong and clear message to the drug industry. Illegal behavior will not be rewarded with continued government-granted monopolies. Our people are paying the highest prices in the world for prescription drugs. One of the reasons is widespread fraudulent activity on the part of virtually every major drug company in our country. It is no longer acceptable to turn a blind eye to that